Tony. Camacho Adam. Felix and Tony. Camacho Adam. They're the right reason for a new season. Together we rise.
Welcome back to a bonus episode of On the Trail with Felix and Tony. I'm Tony Ada. I'm running for Lieutenant Governor in the upcoming 2022 general election alongside Governor Felix Camacho. Off a day.
Off a day.
All right.
Off a day. Well, go ahead.
Well,
sir.
Thank you for joining us every week and every moment on the trail of this campaign with less than 13 days and a wake-up to the general election. Off a day, Governor. What's on our agenda for this special episode?
Off a day, Senator. Well, today's a really special day. We're very excited about it. It is really a bonus episode with some special guests known as the Cranks. Yay! And to explain further, many of you know Frank the Crank Camacho. He is a father, a husband, a professional MMA fighter, a small business owner. And he's married to the beautiful former Miss Earth Guam, Miss Sarah Felix Camacho. She is a filmmaker who's been featured on the Guam International Film Festival. Now, this powerhouse couple are passionate advocates of our island's culture and social issues, not just here on Guam, but in Saipan and throughout all the Marianas. And we are very proud to welcome Frank and Sarah Felix to the trail.
To the trail.
Camacho. Sarah Felix Camacho. How can I forget Camacho? I'm a Camacho too. I always think of your father. You know, when I think of you, I know Jerry very well.
Well, we can get Frank to change his name.
I was about to say now I'm going to be Felix.
Thanks for having us.
Thank you. Thank you for being here and joining us on the trail of Felix and Tony. Gov, let's get right into it with the interview with them.
Yes, well, you know, I think please, Frank and Sarah, if you would just introduce yourselves again and to the audience, because we have a following and many people would like to hear. You are a young couple of great influence. You were influencers, and again, your love for the culture and all that you're involved in. Please introduce yourselves.
Go ahead.
All right, so I'll start again. Hey, half a day. Frank Camacho. People know me as Frank the Crank Camacho. I'm born on Guam, raised in Saipan, and I like to say home is the Marianas. I'm a father. I'm a proud father of 3 little rascals. I have a beautiful wife and just another local boy just trying to live an amazing life in an amazing island.
And I'm Mrs. Crank. People know me as that these days. We're actually here in Saipan right now. We're at my in-laws' house. So if you hear my children running around, screaming, banging on the door, we apologize ahead of time. This is our office for the moment. But we're really just, I guess you can say that we're influencers, right? And
Yes.
We've worked tirelessly and really hard to gain the following that we have today.
Yeah.
So it's really cool that because of all that hard work and recognition, we can actually be here sitting with you guys talking.
Right.
But yeah, thank you so much for having us. And we're really excited to have these conversations with you. This is all going to be completely organic. We don't know what we're going to be asking each other. So no pressure, this is going to be recorded. It's going to be on our social media. So if you tell us something, people are going to refer back to our content case. So
Right.
no pressure.
Okay, well.
But again, thanks for having us.
Oh, it is our honor and our pleasure. Maybe I can begin by asking you both, what are some of your main concerns regarding our island and, of course, the Marianas? You're passionate about many things. So what are some of the key concerns you have moving forward, especially having, we're exiting this COVID-19. It was very contentious and difficult. So, yeah, please share with us some of your key concerns. Thank you.
Okay, so where do we begin, right?
Yeah.
I guess we can flash back a year ago. A year ago, Frank and I were on a similar broadcast. We were with Candid, and we did an interview with one of the governor's medical advisors, and we were really, really stressing on the importance of health and trying to encourage health to be pushed in the government and throughout this whole public health emergency, right? Because when it comes to the public health, it's really supposed to focus on the health of the public. So fast forward 1 whole year later, it's kind of really cool because right now the reason why we're in Saipan is because Frank is doing a lot of work within the CNMI to promote health. And I would like to pass the content over for Frank to start talking about what he's doing here, because it's really exciting. It's really exciting to see him do what he's doing here, and really just kind of the ripple effect on how it's helping the people in just a short amount of time.
Wow.
Yeah. So, wow, where do I start, right? I mean, you know,
talk about your walk, maybe.
Well, I think to start off with, right? I think to address like the elephant in the room, you know, it's hard. We have to say that, you know, like the top 3 causes of or the top causes of death in the Marianas it's really hypertension, diabetes, heart disease, and cancer. So what's really cool, what we're doing here in the CNMI, and you know, I really give kudos to the Gov here for pushing this Fit to Leave initiative, and we're pushing this Fit to Leave initiative to push health, wellness, and fitness throughout the CNMI to get the people healthy, right? In the name of health, wellness, and fitness.
Right.
So what Sarah was talking about, fast forward to a few weeks ago, we did this trek around Saipan. And we did this Fit to Lead trek around Saipan to spread awareness on what Fit to Lead is, but we also had the beneficiary of the Commonwealth Cancer Association to spread awareness on their efforts and the awareness of what they're doing here in the CNMI, all the amazing things. I wanted to personally do it just for personal reasons, you know, on personal fitness reasons, but I was like, man, we can totally tie this into something good and something for the community, something that Sarah and I have been doing for years, you know, because we're just super proud, you know, local islanders, right? We did a total of 40 some miles, and we raised, I think over like $57,000 for the Commonwealth Cancer Association, just to start off this whole Fit to Lead initiative. So this is $57,000 that all these donors and these contributors came in, that is going to be going straight back to the people of the CNMI.
Yeah, you know, and I've seen many of your videos. You were actually out there with Governor Ralph Torres, and you know, he was I guess on your program as well. You know, you were doing a Fit to Lead with him, and you know, getting him out there and active. And you know, what would be some of the things that you would like to see either happen, change, or improve? You know, should Governor Camacho and myself be blessed to become the next governor, lieutenant governor of Guam, that happens here as well, and not just in the CNMI?
Well, I think really meant to push health, wellness, and fitness. You know, again, back to what I was saying, we just our community, we're especially during COVID, especially during the lockdowns, people just stayed at home, and our health started taking a toll, you know? Yeah. So I really think implementing some sort of like a Fit to Lead program, or just like just health and wellness, and just push it within the community and within the government sector and within the private sector.
Yeah, because you know, I think it's kind of crazy that it's been 2 years since that whole pandemic happened. I mean, we're still kind of in it, right? Apparently, but health was not at the forefront at all. It was everything. It was vaccination, wear masks, stay away from each other, and fast forward 2 years. You know, Guam is sicker than it's ever been before. People are being hospitalized for several different reasons. Our hospital, of course, is run down. And I know we always talk about health, and, you know, we're using this opportunity to promote what Frank is doing because we believe how important it is for our people. There's people who are getting diagnosed with cancer or diabetes, or just, you know, dying out of nowhere. And Guam's hospital and our medical facilities aren't being able to accommodate what's happening with our people and the health of our people. So, it sounds like so cliche for the cranks to talk about health, but it is very important. And you see it. You see our people getting sicker, our children. The children are getting sicker. And this stems with also mental health and why people turn to drugs, right? And this and that. But it would be great, even at the minimal, just to promote health, just to promote it. And I know that during the pandemic, Frank and I, we did that a lot, right? And I think that was why we were brought on to Candid, which was a great experience, by the way. It was so amazing. I think we left with very happy because the conversation that we had was great. However, not a lot of things changed when it came to regarding health. And if anything, it was like deemed misinformation, which was crazy. But now we're here and we have the CNMI kind of like spearheading this whole mission to promote health, to help people, to get people healthy so that they don't have to worry about getting the flu or COVID or, diabetes or the other three killers. Health can really save our people. And we don't know politics. We don't know all these other things that affect our island. We're not experts in that, but we are, I can't say experts in health, but we know that health works and it works for us.
Right.
So
and I'd like to add to that. It's kind of like, man, if we were such in a public health emergency, where is the preaching and the information on health?
Yeah. For me, my big concern was the fact that the COVID vaccinations, we're still an experimental process. The testing hadn't been done. We still don't know what the long-term effects are going to be. And if you follow certain podcasts that I listen to and other outlets, other than the what we can call the legacy media outlets, NBC, ABC, CNN, and the like, MSNBC. I tend to like to look at different sources, but even Pfizer officials coming out saying, well, we didn't really study as to whether or not it would prevent the contraction of COVID-19. Now they're coming out saying, yeah, we didn't really know, and it's saying now word is coming out that it really didn't prevent that. And of course, the whole controversial thing about ivermectin and all the other traditional methods of medication for early onset treatment were demonized, and so the concern about that, and then of course the separation of you've got vaccinated versus unvaccinated, and the division within the community. It created a lot of stress and a lot of fear that had been out there. But I want to go back to your idea about fit to lead. Are there any aspects of it which are dietary? What we eat, other than the physical exercising, what we eat and our nutrition and the practices that are traditional. In the Marianas, I mean, you go to a party and the kind of food we load up on that plate is it's impressive, but I don't know if it's necessarily healthy. So could you talk on that?
So Gov was asking, is there, for Fit to Lead, are there any initiatives with diet that you're pushing?
Yeah.
Oh yes, totally. I mean, I think the first and foremost right now, aside from getting active, right, is if you follow me on social media and if you follow the Fit to Lead, I kind of made this little skit of drink water, but at the end of the day, right, like it's gonna be tough, especially when you have habits of fiestas and everything growing up. It's what makes us tomorrow, it makes us the Marianas, it makes us Guam, it makes us our community, what brings us everyone together, right?
Yeah.
But if we're gonna slowly start showing and slowly start introducing little diet tips, I don't even like to call it diet tips, more so nutritional tips, right? Like drinking your only drinking water, eating your calories. Maybe instead of getting 2 full fiesta plates, maybe just start off with 1, right? Or and then you could start slowly introducing, there's a lot of big things when it comes to intermittent fasting, right? Let's not eat at eating ice cream, even though I'm guilty of that, right? I'm super guilty of it, but let's start eating, stopping at certain times and eating toward later, or what I've been doing and what Sarah's been helping me out a whole lot with is just eating till you're content, not
Right.
till you're full,
Full.
not
Yeah.
till you're hospuk,
Yeah.
and apparently that that is something that's just kind of been pushed on, through the generations, right? Of eating till you're full to the brink or finish all your food, Kiko. But these small little tips, I think, is going to be key through this Fit to Lead program, and I think coming together as a community.
Yeah, and Sarah, you also touched on a very important part of also being fit, and that's fitness of your mental health. And that was actually brought up to us the other night when Governor Camacho and I attended a function. That our manamko, we need to re-engage with them and have them brought out of their homes. They want to be a part of society again, right?
Yeah.
They've been locked up for 2 years to stay at home because the fear was instilled in them that you got to stay home. So now all they want to do now is come out. And when you touched on mental health, I think from our youngest of children to our older generation, our manamko, right? We always have to ensure that we look at their state of mental health and how is it that we can improve on that as well. And I know the pandemic really took a toll on and both of you were very vocal about being forced to take the vaccination, and then also being restricted from simple things like working out, going out and running. Can you expound on how the ongoing executive order and the restrictions kind of affected your life, or even what the quality of life with your family?
Well, I guess I'll start, and then you can add on to what I have to say. But of course, immediately after watching the video,
Mm-hmm.
and Gov, if I'm not mistaken, you're not vaccinated as well, right?
Yeah.
Oh, you're not, right? Okay, sorry.
No.
Okay, so when you hear,
I've never gotten
Our-
COVID, but I'm taking as much nutrition as I can. No, the issue of whether I'm vaccinated or not is something I prefer to keep confidential because it can always be politicized. But in line with what Frank is talking about, I really do everything I can I walk, I watch what I eat. I take as all the supplements that I necessarily can, and my entire family has gotten vaccinated. Every single one of them has got, despite the fact that they're vaccinated, have gotten COVID, and so it's all around us. But I feel that I may have had maybe what is considered to be a flu or something similar to that, having experienced it, but I think the natural antibodies, I've already got that in my system, so I'm good with that. But go ahead, Sarah.
Yeah, viva.
Thank you.
But when that day did happen with the executive order and hearing the governor basically call us the pandemic, which is
Yeah.
pretty insulting and threatening. That's how we felt, right? Because
Right.
now we are like enemies of our people.
Mhm.
We go from hero to zero in a split second. And of course, Frank and I, we were immediately afraid a little bit. We were lying in bed, holding our children, and talking about, man, are we going to have to leave? Is the National Guard going to be banging on our door? At that moment, we had no idea. We were seeing videos online in Australia, how they're like throwing people in concentration camps or, separating people from society because of
Right.
their medical decisions. And and the craziest part is that Frank and I, we invest so much into our health,
Right.
so much that it's very strange to have unhealthy people tell us how to be healthy
Right.
and then threaten us. So of course, immediately we were, we had to have this conversation about what we're going to do. And Frank is like, well, I'm, my life and my livelihood revolves around the gym and representing Guam. So I'm going to have to leave because I can't do my work here. So that means I have to stay home. I have no idea when my husband's coming back. I have to hold the fort down.
Right.
It just made everything so difficult and scary because who knew what her next decision was going to be, right? So it was a very, very strange time for all of us. I think people were saying certain things to each other that I never knew people would say. Comments like, I hope, you get sick and you have no business being in the hospital. You have no bed there because you chose not to get vaccinated. Basically saying, I hope you die, which was very strange to hear from people that we know about people who decided to make medical decisions for themselves. So, I don't know if you want to.
Yeah, it was like an automatic cause of separation.
Yeah.
Now you just segregated everyone.
Yeah.
Basically, in a nutshell, right? Like, now we were the enemy of the state. We were the scum of the island. It's all our fault. You know what I'm saying? Like,
Yeah.
Sorry, I'm just getting emotional, but that's how it was. It got to the point where they were, the saying was, oh, but it's oh yeah, if it's your choice, then if it's for your job, then whatever. I needed to go to the gym because that was my job.
Yes.
According to the law or to the executive order, or I don't know, whatever it was, I couldn't go to the gym. I couldn't do my job. I couldn't train. And all I want to do is just represent the island where I come from. Come on, man. Let me just go train. But for me, I had to devise little training sessions, and it was because I was doing something illegal. But at the end of the day, I had to leave, and I had to leave my family because I couldn't do my job, and I couldn't do the job that provides food for my family at home court.
Yeah.
For the people.
For the
island.
It's very complex, but that's how it really was.
And then to top it off, we were from the get-go trying to encourage health, right? And because health works, it just does. It puts you in a better place to get healthier, to allow your body to fight viruses, right? It's common sense, right? Yeah. But then people who decided, to have medical autonomy over their bodies were banned from going to the gym. So how are you supposed to?
The very thing that made
people?
us healthy.
I mean, I don't really want to focus too much on this because we've said what we needed to say, and then that's in the past, right? I think a lot of people have learned that there's too much information out there to not realize people were wrong, and whether someday down the line people will come out and admit it, that would be great. I think a lot of us would be so happy if there was just a public apology, honestly, because it's true. It was noble, and we didn't know anything about it, or what we did know, we were just following what we were told. Yeah. And people were making decisions what they thought were best for the people on the island. We understand that, but now that we have more information, I think is it too much to ask to have an apology? Because it was a lot for a lot of people. It changed our lives. It changed so many people's lives, and so many people. I don't want to touch too much about it. But that is the answer to your question.
But the important thing now is the fit to lead, leading a healthy lifestyle, going out there, exercising, being in a great mental health state, great physical state. So, what you guys are doing is just truly admirable, and we appreciate everything you're doing up there in the CNMI, and hopefully we'll be able to replicate that down here in Guam, and it'll be a Marianas thing, right? Yeah.
Man, you know what was so cool is that we finally came out with like this ad and this campaign on a fit to lead, how to beat COVID, right? And it's really just like a guidance of how to get yourself healthy, because if you're studies show that if you are metabolically healthy, you have a massive chance of not suffering from severe COVID symptoms.
I see.
Yeah.
And that, if you're metabolically healthy, so this campaign that we're trying to run, the drink water campaign, but go out and exercise, 30 minutes a day, 4 times a week.
There.
Go get some sun, go get some sun. Do outside activities, yoga, whatever it is. And drink water, eat wholesome foods. Let's stay away from the fried foods and from the and from the high saturated fat foods. So let's come together and let's take ownership of our health, because whether it's fighting COVID or all the other diseases, there's nothing wrong with being healthy.
Yes, and I think, as you mentioned, with hypertension, diabetes, and cancer, it's at from what health officials have told me, it's at an epidemic level in the Western Pacific. Not only the Marianas, but throughout the freely associated states and the like. And so I think all government and all communities must do everything they can to get healthier. One thing I do want to share is I was so excited that within my family, my daughter, my son-in-law, my grandsons, they really got involved in mountain biking. They got, I know that the sporting goods stores like Bike Fix and Hornet were quite happy with, they couldn't keep up with the demand for the mountain bikes, and people were out and about riding. And so it's created that synergy of just getting out there. And then, of course, they began to be able to congregate and go through the trails. It's kind of slowed down with the rainy season, but once things clear up, they're going to be out on the hills again. So, yeah.
And Gov, going out there, not only do you get a good exercise, you get really good bonding with your kids and with your family, but man, you get to see a whole side of Guam that not a lot of people get to see.
Absolutely.
It is beautiful. Absolutely. Beautiful.
Yes, wonderful.
So, we come to this part of the segment where you get to ask us questions.
If you have any.
Let's go.
Dude, how high can you kick?
Well,
it's
really, was that a question? Yeah. So this is the part where now we stay interactive, and you can ask us some questions.
Yeah, but Frank, for me, when I was much younger, I was really very much involved in sports. Everything from basketball to football to volleyball to soccer, baseball. I started off in Little League baseball in the villages. Back in the day, those were fun, and throughout all the high school things. And then I got into a bit of martial arts when I was younger. I picked up a little bit of boxing here and there. I picked up taekwondo, of course.
Taekwondo, yeah.
I did taekwondo. I did white crane.
And we'll be right back. Just like you, Felix and I are outraged at the growing crime rate and lack of justice on Guam. We are outraged at the number of criminals arrested, released, and back on the streets committing more crimes. Along with crime prevention and reduction initiatives, Felix and I will work with lawmakers, law enforcement, and the courts to reduce repeat offenders. Prevention, rehabilitation where possible, and harsh punishments for criminals. It's time for a new season.
I'm Felix Camacho.
I'm Tony Ada.
We approve this message.
And now, back on the trail with Felix and Tony.
A little bit of that. But see, before my time, we didn't even have wrestling. We didn't have jiu-jitsu. And now I'm really happy to see that, there's so many more options for the youth to get involved in all these different martial arts. It's a wonderful thing. And, it takes the aggression off the street and brings it into a gym. And then they learn respect. They learn discipline. And it really changes the individual from the inside out. I've always felt that sports gave me a great opportunity of teamsmanship, being able to coordinate and cooperate with so many others. And so the benefits of it and this active lifestyle you and Sarah are promoting is very laudable and commendable. So keep it up.
Yeah. With me, I joined the military, so I was very active physically
PT
until I got out. But, it's just fortunate that, with our family business as well, a lot of it is manual labor. And that's what actually kept me fit. A lot of walking, a lot of carrying, we go up and down stairs, heavy lifting, things like that. So it may not be, it probably perhaps wasn't in a gym, but, just the everyday physical exercise that we did at work. And then, Annette and I used to go walking every other day down in, down at Adelup. And, when after COVID, the lockdown ended, we started walking. And it's something that we need to get back into again. And, I think the beauty of it is that, it brought us together as a family, right? Doing outdoor activities together, and it was very enjoyable, and we look forward to doing it again.
Just to add on to what you guys were saying, and I think, especially when you have someone like a UFC fighter trying to push health and wellness and fitness, it may be very intimidating at times because it's like, oh man, I gotta go run a marathon to get in shape. But that's not the case. Just exactly what you guys were talking about. It's just really just getting active and just doing a little bit more extra research. And we're here to help push that initiative, that initiative, right?
Yeah.
Whether it's that 3 times a week walking with the family at Paseo, or if it's playing a sport, or if it's doing martial arts, or if it's go and clean the yard. 3 times a week, whatever it is. I truly believe that we are all capable, and I really believe in the Marianas. I believe in Guam and the CNMI that we can get fit to lead.
Yeah, and that's why I also, as a father, keep Boo fit by doing the bush cutter shuffle. So,
Good job.
Hey, can you have him swing by the house?
Yeah, we have a yard.
So we can get more
and
fit?
I actually wait until the grass is like 4 weeks over, and then him and I are outside doing the bush cutter shuffle. So it's a family affair. But so what other questions do you have for us?
Well, okay, I just want to kind of touch on what Gov was saying. You were talking about the importance of kids getting active and how it really teaches them discipline, respect, and, just being overall healthy. And that's something that Frank and we really try and use our social media influence to push, with our kids and get them involved, get them active, throw them outside, get them dirty, get them healthy, and give little tips like in the morning, make them a smoothie, have them juice, whatever. And just to kind of push that, because it's really sad to see the numbers coming out about childhood obesity in Guam. And, eventually these children are going to become adults. And at the current state that Guam is at, I don't know if we're going to be able to provide the health care that these children will need if they don't change their habits now. So that's why we really try and encourage that for kids, because we're parents and we care about children. We just have that connection. You're parents too, and when you just want the best for the younger generation because they're going to be the next future.
Yeah.
So I made up, I don't know about you, but I had a list for you guys to ask some questions. But since we're on the topic of health, let's just stay there. And then if we have time, I want to kind of pull out my phone and ask you a few questions.
Okay.
But I'm curious, right? I always think, if there was another leader leading our island during this crazy period, what would you have done differently during the pandemic? Is there something that you would have done or would not have done? Because we're all curious. We're all wondering, is there something, would I have done the same thing because my advisors gave me that advice? Or would I have done something differently? Would someone else have done something differently? I hate to throw you guys off or put you on the spot, but we're so curious. We're very curious.
I can begin by first stating that in the multitude of counselors, the saying, in the multitude of counselors there's safety, and so of course you had the medical professionals that were surrounding, and they formed a task force, and that's where they gave advice on how to proceed. But there's also other sectors of our community. You have the business sector that were gravely affected, and so many aspects to our society where you need to. It's got to be more inclusive in making decisions, because it was from the top down as far as decision making, from my observation, the way things had rolled out. Secondly, I know that there's always an organization of governors, National Governors Association, and access to different approaches on how state governors are running their particular states. And one thing I've noticed in the past, having attended many a meeting or conference at the national level, is that the way governors run their particular states or territories, as opposed to the imposition of the federal government upon each of the states, there's always that conflict. There's always that check and balance. And it's always a matter of saying, listen, federal government, big government do not impose too much upon us, because we have been elected to represent our people. We will decide what is best in consideration of all that you're pushing down. And so I believe it was very heavy-handed by, of course, NIH and the CDC and other organizations on how they rolled it out. But I would have looked at, as I mentioned before, other states. Governor down in Florida has done a tremendous job. Down in Florida, yeah. South Dakota, I know Christy Nome, she or North Dakota, she kept her economy open and running. Even our governor in Saipan, the level or the extent of shutdown wasn't all that great. And I really feel that people value their freedoms, and the authoritarian approach was a bit heavy-handed. I felt everything from roadblocks to lockdowns, shutting down of businesses, determining which businesses can stay open, which can't, who's essential, who's not. The mandates that came about forced vaccination, especially in the government of Guam, for example. And if you wanted to keep your job, you'd have to get vaccinated. As we talked about the vaccinated versus unvaccinated. But more than anything, it was the freedoms. The shutdown of the schools, the shutdown of the churches, the lockdowns, those were very, very damaging. And I really feel that the long-term impact of the social economic impact is going to be felt for years to come. Mm-hmm. And we're dealing with it right now, and there's a real need for you see the crime rate that's gone up, the drug. An individual had to turn to alcohol. They were so depressed. They were locked down, isolation, separation. Human beings are social. God made us to be social, to be interactive. We need one another. And the impact of that was really terrible. So I would have, again, really had to consider what is fair, what is just, what is right. Where's the equity in this? And then are the successes of other jurisdictions and their programs and how they've rolled it out working versus the territory? And can we learn from others and what they've done successfully?
Yeah. And the ironic part of all this is that just weeks prior to the first lockdown, we actually did a pandemic update where the government and the community stayed for 3 days at the Pacific Star, right, the Marriott, where we were there for 3 days going over the pandemic plan, only for that plan to be shelved when the pandemic broke out. And they were reinventing the wheel all over again in what they're going to be doing during the pandemic. And I think that had really hampered the progress during what they actually have done and what could have been done during this pandemic. So, when they shelved the pandemic plan and reinvented the wheel by doing their own, that really hampered a lot of operations and perhaps set back our economy by 6 months, easily 6 to 9 months.
Oh, I never knew that.
Yeah.
Wow.
So interesting. Wow, great answer. I mean, it makes sense, right?
It
makes
does.
sense. It's easy. It's always easy for us to just kind of sit back and, kind of judge, right?
Yeah.
Especially we're not in a seat or public office position where we're making orders and decisions, right?
Yeah.
But we are voters, and we vote for people to lead the island. Not control the island.
Yeah, so I'd like to ask you then, having stated that, then what would it take, what would help your generation and the next generation to be interested in elective office or public service in government? Because there seems to be a real lack of interest and just they don't want to get involved. But it is absolutely necessary.
To be involved.
To be involved in so what is it going to take for the next generation to get involved or to be at least interested and participate?
Or what is it going to take for Frank the Crank Camacho or Sarah the Crank Camacho to run for public office?
I think, we're not, we're just gonna be transparent. It comes to us all the time. People always ask us.
Yeah.
And I think right now, because our kids are so young, and seeing a lot of kids kind of take a turn at a certain age in their life because their parents are both very busy, we kind of want to reach that point where we know our kids are going to be okay because mom and dad are not too busy. It's a concern for us because, like you were talking about drugs, they're hunting. People are hunting for customers, and neglected kids are number one. And so that is our number one reasoning. When people do come to us, we're like, right now, our focus is our kids.
Great.
And making sure that we do what we need to do to take care of them, raise them, put them on the right track, put food on the table, but at the same time still do what we love to do and do what we're good at, like this Fit to Lead initiative. Frank now sharpens knives, so if you have dull knives, this is my little drop here, so sharpen your knives.
Dude, I'll make it shinart.
But I think in this regard, it's something we talk about often, because we're up and coming. It's us next. It's our turn.
Yes.
There's leaders in our home and in our islands, and we need to do it eventually. But I think it would be great if Frank and I actually learned a thing or two about politics before we get our foot in there.
So it's actually a thought then, right? I mean,
It's a thought. We always say that down the line, but I think to answer your question, why people, our generation, are kind of avoiding it is because we still see the old way of politics happening. And it's such a turnoff for people like us, right? Like we don't see parties, we don't see Republican and Democrat. We see people who want to lead our island, right? Service. We are so blind to the party. We just see people for who they are and what they're capable of doing and how they can lead our people. And so when it comes to what we're learning about politics and how politics are run in the islands, and this you scratch my back, I scratch your back kind of thing, for us, it's like, how are we supposed to do what we want to do if I need to now make sure that I paid this guy because he did this, and or if we don't do that, everyone else is doing that way of politicking on Guam, and it's on our topic of conversation for our generation. We talk about it, we know what happens, and until that, and I think Frank and I, we talk about it because we have a lot of friends too who are interested eventually becoming leaders and sitting in office, that we all just come in at one time. We just all come in and do our best to stop that politicking. Like, get in there because people want us there, not get us there and see what they can get out of it.
You're right.
And I think a good start would be sort of a go and register and go vote campaign.
There you go.
Because I feel like only till you when you vote and something happens, whether, how do they say it, like an island raid, whether it's your Godzu or not, whether it's now you're connected to that decision. Now it makes more of that decision is more, you feel it a little bit more, whether it's good or for the worst, and how do I guess having more of our generation going out there and voting and campaigns of educating the importance of going out and voting, I think would be a good start, because now and then that would just start shifting toward the idea of like just having this generation just a little bit more involved.
I do want to say that anybody that is in elective office or public service, it is a sacrifice. It does require a lot, and I can totally relate to you about how the impact upon family, because of the time constraints and how it takes you away from there. But to quote a gentleman who's an author and teaches a lot on leadership, a guy named John Maxwell, he says, leadership is influence, nothing more, nothing less. And so, the cranks, the two of you are
Yeah.
leaders because you are influential. You are influencers, and so as you think of yourselves and the role you're playing in your community, you are leaders in your own right, and you must continue to spread that message with all of your peers in your generation. That all those of you, leadership is influence, nothing more, nothing less, and go out there and continue to influence because you are leaders. So.
And thank you,
You bet.
Dub. And I think more so, what's the saying? Like, we're not trying to be the hero. We just want to save the day.
Yeah.
And
Yeah.
what is really cool is that Sarah and I've been doing all of this ever since
Yeah.
living the island life, pushing family, because this, like, all of this is really what makes us islanders us.
Right.
Man, like, the fact that I love my wife the way that I do, and it really just translates to the way that I love my children. And then I truly feel that because of this environment that I'm trying my hardest to create, it's like the best investment that I can give back to Guam.
It's amazing.
The more I can invest into my kids and into this relation, to this thing that I have going, it's only gonna just benefit Guam for generations to come, right? And it's so cool, and we're so blessed that people resonate with that.
Yeah.
That people dig it, and whether
Yeah.
it's a like, whether it's a share, or whether it's a shaka or a honk when we're on the side of the road or whatever it is, it's so humbling,
Yeah.
dude. Just seeing you guys on the screen, it's just so humbling. And
Yeah, thank you.
I think we just got to continue, or at least we're gonna, everyone has to continue to just keep the mission statement. Keep the mission statement, and I think it's in our national anthem, para y honra,
Right.
for her honor, for the island's honor, for whatever would make the island better.
Yeah.
Well, thank you guys for making a difference, a very positive difference day in and day out. So that's important.
And we know that you both are very respected in the community and in different arenas on island. I mean, in the Marianas, really. And we're thankful to have you on our podcast, and to be here with us, and to have the support of the cranks for the Camacho Ada, is truly appreciative. And we are greatly we're grateful to both of you and your family for that.
Well, thank you so much. We're honestly so honored that you have us here.
Dude,
It's our
can I
pleasure.
ask a question?
Oh, absolutely.
Sorry.
Yeah, crime's on the rise.
Yeah.
And I think it works in correlation because of drugs on the rise, right? Like
Mm-hmm.
never before. No, I'm a trained UFC fighter. If someone comes to me hand to hand, I have very confidence to defend myself and my family, right? But to the point where, I had thank goodness for the Second Amendment. I have a CCW, just because you
Yeah.
just never know what's going on, right?
Right.
Anyway, like what is the plan? To address the drug issue and the crime issue, like with the island. I know it's such a complex issue, but what would be the plan?
Well, we've got to go back to basics. A DEA agent was out here. It was in the news, and I believe he was given a seminar for businesses to recognize, that the use of drugs in the workplace, and here are all the symptoms. But we all know that the amount of drugs on Guam, especially meth, which is the primary drug, is rampant. It is so widespread that it goes across so many different demographics in the age. Number one, from our youth up to professionals, well-employed people that are out there. Every single family has been affected. It's down between $100 and $150 a gram, where it used to be $600, $700, $800. And so, because it's so cheap, it is obvious that there's an abundance of it out there, and it has led to many petty crimes, and even now to the level of violent crimes, to the point where we've got almost a murder a month. We've got to go back to basics. We've got to properly man and train our Guam Police Department. Also working alongside with Customs and Quarantine, all the relevant public safety and law enforcement agencies within the government of Guam tie in with our federal counterparts and make sure that we get proper designation for Guam as a high-intensity drug area. You get that designation, we get more resources, work alongside with the courts, understand how they're being overwhelmed, work with the Attorney General. But recognizing that this is going to take a concerted effort, not only in Guam, but throughout the Marianas, understanding that this is an international trade that's going on between Mexico, California, throughout the West Coast, through Hawaii into Guam and throughout Southeast Asia. So we have this drug epidemic, and it goes hand in hand with crime. People are living in fear. And so we're going to tackle this head on with all the resources we have. It's going to be a priority for our administration, and we're going to take it head on very seriously.
And, we have to build our families again. Work with Guam Behavioral Health and Wellness and other nonprofit organizations to get our people healthy again, get them back to, being employed, because when people are employed, the less tendencies to do crime and rebuild their families. And that's what we have to do, is start from the ground up again.
Another thing, just to close this one out, is what do we do with the aftermath? There's so many of our young men and women that their lives have been destroyed by drugs. And what treatment do they have? Can we engage private sector as best as we can to bolster up GovGuam and our treatment programs? Can we involve faith-based organizations and other resources that we can include, even the Department of Defense and the military community that's out there, reach out into the municipal level? So I think that pretty much covers what we're going to do. We've got to take this head on.
Yeah.
Thank you.
Great. That makes perfect sense.
Yeah, it makes perfect. Yeah, it makes sense.
Wow, thank you so much.
Yeah.
Thank you so much for having us. It's been truly an honor.
No, the honor's all ours.
Hey.
Yeah.
Thank you so much.
We truly appreciate it. Any other questions? You have any other questions for them? You have any other questions for us?
If not, we just thank you for the
do.
time.
Hey, if you have another one, sure, we can go another one.
Hey, let me get this. Pull out my phone. Oh, sorry. I don't know if you're hearing all the commotion that's going on in this house, but our kids have been just going wild.
Yeah, I don't know if you.
Showering.
Shout out to Grandma and Grandpa for holding on the fort outside.
Yeah. I don't know if you can hear all the commotions going on in here, and they're not children.
I do have a question, but before I ask you it, it's kind of like a left field question. But before I ask you, I do want to show a lot of love to the people of Guam. And going through this whole pandemic all together with all of us, I know it's been really hard, and all the people, we always love to give love to Mary Rhodes with GHRA, and really just kind of going out there and making sure businesses are afloat. Like, anytime I can give that lady love for the amount of work that she's done for the island, it benefits all of us, right? So the first responders, teachers out there who had to teach and then stop teaching and then teaching, everyone that was affected, we got through it. So I just want to show everyone some love out there. We're really excited for the next few weeks because, soon we're going to find out who's going to be leading our island. But at the end of the day, we're all got to just do this together.
Right.
Yeah.
My question for you, and I just want to ask this on behalf of all my Earth lovers from Guam. What are your thoughts on the open fire and detonations going on over there in the northern beaches of Guam?
I think we really need to take a very serious look at that. Of course, everyone is saying you've got to cooperate with the DOD and their mission, but it's always had to be mutually beneficial. That's always been what I've said. Open burn pits, there are very few communities left in the United States, but the effects of that, especially for residents downwind from where these burn pits have been happening, the medical conditions of these in these rural communities have been terrible. We've also got our aquifer that we need to be concerned about, and so DoD has their mission, but we have to stand up and ensure that we fight for the environment and the safety of our people and the longevity of these things, because of the perhaps even unintended consequences.
Okay.
But something like an open burn pit on a Pacific island, especially here in the island of Guam, I really have strong feelings against that.
Yeah.
Okay, that's the right answer.
Thank you.
It's
so true.
concerning because
No,
we
it
all
is.
live on
Yeah.
Guam, and it will affect us. If not now, it'll affect our children. I mean, water for us, we always say water is life. Whether you put it on you, in you, it will affect you.
Mhm.
And all that chemical and
And
toxic.
nobody really knows what they're burning, whether it's explosive ordnance that they're getting rid of or chemicals that they're burning up. Who knows? And that's the danger. Is that once you get that open permit granted, whether it's by a federal agency like EPA or the like, and then the consequences we have to deal with.
Right.
We're affected by it. And yes, they have their mission, but our responsibility is not only for the land and the air and the sea, but our people
The health and safety.
and the health and safety of our residents. And that's what we have to fight for. I've been in many a fight, with the federal government, and this is one that we really have to take a serious look at. What is before us now? I'm not in office, so help us get in there to fight it. Thank you.
All right. Perfect. All right. That one was for my sisters out there.
Oh, that's great. Well, that brings us to the closing of our podcast here, and again, we'd like to thank Frank and Sarah, the
Cranks.
Camacho, for being with us today. We truly appreciate you. We truly appreciate the time that you spent with us. You could have been doing anything else, but you're taking this time out to not just educate our people, but educate us about who and what you guys are about and where you guys stand on certain issues. And we did likewise with you. We let you know who we are and where we are, our stance on certain issues that were important to you as well. So, with that, Gov, you like to give the closing for them? And
It's just thank you so very much. Again, blessings upon the both of you from our good Lord, and continue to set the example. You guys are a role model for many in your generation. Continue to make that positive difference in the lives of others, and continue to set that good example. God bless you, and thank you so very much.
Yeah.
This is
Thank
Masi.
you. We'll do our best. And everyone out there, go out and vote, please.
Well,
Thank you.
Viva
Thank you.
Guam, Viva Marianas.
Viva.
Viva.
Thank you.
Felix and Tony.